The provider that night, first comment was that the flu is rampant right now. So I felt like going into it that this was kind of what he was going to look for was flu-related symptoms. So we did like a normal workup. And I actually said to him, can we please do blood cultures? And he's like, well, this is a viral presentation. I don't think we need blood cultures. And I said, well, with my past, like I usually get sick and I get sick fast. So I would just like blood cultures for my own, make sure. I said it takes a long time for him to come back. So I know I have to wait, but I would like them. So he agreed to doing the blood cultures and everything. And, just a normal routine, gave me some Tylenol for my low-grade fever, kind of waited it out. Well, during the time that all this was happening, my brain was just going crazy because I've had so many of these episodes, and I kind of had that, like, they call it like the doom feeling, like this is not right, something's wrong. So that was where I was at during this. And it didn't feel like he was quite understanding that that's how I was feeling. So trying to explain to him, my presentation might seem like a viral infection, but when I get sick, it's instant. And so I just want you to make sure that we're crossing all the T's, dotting all the I's. I guess the hardest part for me looking back as a patient is I knew that I didn't feel right, and I was trying to portray that to him, but it was almost like he's convinced at this point that it's viral and that there's not anything further he can do for me that day. Coming back to the hospital, I'm in a panic in my head that I know this is not good. This is not normal. There's something wrong. I'm so fatigued. I can't stand. Like I had to be pushed inside in a wheelchair. So the triage nurse this time literally said, we need to get you back there right now. So he wheels me back, and I remember him saying to the staff that were kind of at the nurse's station, she's got 4 of the 5 signs of sepsis. And so they pretty much said we should keep you in ICU for several days while we're trying to kind of figure out what we can do to regain circulation to your feet. So that was when I was like frustrated. Like if he would have just listened to me, if he would have listened to what I said and how I crash fast and how if I have a fever, these things are not good for me. I know my body. I know that this was going to lead to this. So that was kind of where it all kind of came back, and I was a little angry, I guess. I knew that there was not going to be circulation regained to my left leg, so they were going to have to amputate. The hardest part of that was I had such severe pneumonia that they couldn't put me under. So I had to wait, I think it was 23 days before they could do the amputation. So watching the progression of my foot being white to turning purple to turning black to the skin shriveling to the extreme amounts, I guess I would describe it as like neuropathy. It was just constant pain, tingling, burning sensations.
If you could go back and talk to that provider today, or even if you observed another provider that may have had the same bedside manner and thought process, what message would you give that provider?
My message would be that we get into these day-to-day routines. I can't imagine what the ER physicians see on a day-to-day basis. I know that it's not a simple job either, but I feel like assumptions are made from the beginning of the patient coming in just by what the vitals look like when they present, what the tests look like. And there's cases like me who have this significant medical history. And I feel like I'm a more rare case, like there should have been more paying attention to what was happening in my case because of my past medical history. But there's still patients out there who don't have a history like mine that go septic. And so keeping in the back of your head that this patient is telling you that they don't feel right. I mean, that impending doom is a real thing. I never really thought of it as a real thing up until the point that I felt it. And so listening to the patient tell you there's something wrong, there's something wrong, there's something wrong, and taking that and saying, okay, well, let's look at it in a broader sense and not just narrow in on what we think it is. That would be my only message that I could share.
That's a powerful message. Treat each individual person.
Mm-hmm. Yeah, exactly. You know, we're all individuals. We all have different ways that we present. Everybody's body responds differently. You know, just don't have an assumption that that's what it is and treat it as that's what it is without looking a little bit further.
And what would you tell the general public or a patient that comes in?
My message for patients, especially dealing with a family medicine type of world, we see a lot of things too. And so my message to patients are, when you feel like something is wrong and you feel like things aren't being looked into on a deeper level and you're not improving, don't be afraid to ask for more. You know, fight for that care, because sometimes we have to advocate for ourselves. It's nice that we have nursing staff and even providers that advocate for their patients, but we need to make sure we're advocates for ourselves and that we don't just fully rely on the medical providers to be our advocate. So that's kind of where I push patients. If this does not feel right, just make sure you push that message and ask for the care that you think that you are deserving and needing at that moment in time.